2, 3, go. Yeah. Sierra.
Hi class, we created a pamphlet with the most important and common topics and questions about sexual health in order to make the right decisions about factors affecting our bodies. It's important to understand all aspects of sexual health, even if some aspects don't pertain to you.
So a good thing about these pamphlets is that they tell you a lot about different aspects of sexual health that kind of you might feel uncomfortable about asking. So if you feel uncomfortable at any point during our discussion about it, you can always just look at the pamphlet. That's a good idea so you don't have to ask questions. Or if you ever feel super uncomfortable, you can always just step out. We can keep it kind of like an open conversation. And you'd always just make sure that you feel comfortable at all times. So a good thing about sexual health is that once you understand all the information that we show you, you can make your own decisions about what you want to do pertaining to your culture. So obviously we have a wide variety of cultures in a classroom, so we want to give you all the information and then you can make the appropriate decision based on your own beliefs.
Just you and your crowd doing tricks you never seen. I bet that I can make you believe in love and sex and magic.
Yes.
So what is actually considered sex?
Sex means different things to different people. There's no one clear definition. Whatever your preferences are, you have the right to decide what sex means to you. Some common interpretations of sex are kissing, vaginal sex, oral sex, anal sex, any sexual touching.
Yep. What forms of contraception are there?
So there are a couple different forms of contraception. The most widely used form are condoms. So condoms actually aren't the most effective, but they do protect from STDs and no other form of contraception does. So other forms of contraception, there are pills. So that's actually another really common form of contraception. It's usually like a combination form, so it has estrogen and progestin in it. And then you have to take them at the exact same time every single day for them to be effective. And they actually are highly effective when you take them on time. So other forms that aren't as widely used are forms like an injection. It's called Depo-Provera, and you take that every 3 months. That's highly effective as well. There's an implant that you can get a little incision in your arm, and they put a rod in there, and that's good for 3 years. And then there's IUDs, which are inserted vaginally. So those are good for 5 years, and both the implant and the IUD are reversible. So another form that we have is obviously abstinence, and we actually have a guest speaker that's going to come in and talk about that too.
Hi guys, my name is Olivia and I'm here to talk to you more about abstinence. So firstly, if abstinence is something you believe in, you should not feel like it is a bad form of contraception or something you shouldn't do. Abstinence is the only form that's 100% effective from pregnancy and STDs. But promoting abstinence as the only form of contraception has proven to be ineffective. Ultimately, the choice is yours, and that's why it's important to know the pros and cons.
I have a question.
Yes.
So all of my friends are sexually active and they make fun of me because I'm not. Should I be having sex now or, I'm not sure if it's the right thing to do.
No one has the right to tell you when it's time to have sex. The decision is yours, and you should never feel like you have to engage in something just because your peers do.
If a partner or someone else is pressuring you into having sex or engaging in sexual activity and you feel uncomfortable, just say no and remove yourself from the situation if possible, just because that's super important and so nothing else can transpire from that. Consent is the most important factor in maintaining respect for your own body, and others should respect that as well. If they don't and you're in danger, you need to alert authorities or ask for help.